Hi everyone, hope you all are doing really well. So this is another healthcare project wherein we discuss about the healthcare domain or what all systems are there, applications are there. So this is one of the applications which is hospital management software wherein we as a tester or developers work on that area. So what all things are related to hospital management software is there. We're going to discuss that about into in this video. You can also say that you have worked on this project, so you will be having some architectural layer understanding of this project, and that same you can mention it in your resume and same you can convey it in your interviews. Okay, so before we start, a very happy new year to all of you, and if you're watching this video in this new year, and don't forget, if you're new to this channel, please subscribe to my channel. There are a couple more videos on healthcare domain, and it's very useful, so you can watch those videos on different domains. So yeah, even banking domain videos are also there. So let's go ahead, and please don't forget to subscribe my channel and click on the notification below, and do share and like this video. Yeah, please just go ahead with this. Now the project overview. The client of this project wanted to build a full-fledged software solutions that will help hospitals of all sizes and scales to efficiently manage every aspect of hospital operations, and hence focus more on providing quality medical care to patients rather than spending time in administrative and organizational tasks. So in this project, we developed a hospital management software with features that would streamline workflow and help hospitals to grow over time. So this is also, you can say, like this can be say in this. I think this is very, when someone asks you can give me your project overview, so this is what you can convey. So there will be technology used also. You can also mention the technology used to develop that, and it's good as a tester also, you know what technology you guys have worked on, like the backend code, in which language it has been written, what all integrations has been done, and what all technology has been used to develop that software. So it can be AngularJS, HTML, CSS, jQuery, and MongoDB, uh, Node.js, ExpressJS, Google Cloud Services like GCP can be used for the CI/CD, and the payment gateways or chat SDKs. So like that you get mentioned. So if you're telling about the technology used also, so they'll know that you really have worked on. So uh, this really impact. Okay, so that, don't forget to mention the technology used. Okay, then we'll, if somebody asks you, give me more details about your project, so here is an overview. And I think this, whatever mentioned in this one, I think I'll be having a lot of series on softwares which is being developed in terms of healthcare. So stay tuned for these video series. And I think the one, it will be short, it will not be lengthy, but I think this is sufficient for your interview, in terms of your interviews actually. So yeah, so this is, one is patient management system. So there will be a couple of systems or maybe the modules into your software. So one is the patient management system. So there will be a couple of feature, right? In the software there are functionalities or the feature which are associated or integrated and then make a software. So one will be patient management system. So this feature facilitate medical staff to keep track on inpatients and outpatient as well, and occupied and available beds. So in that feature they can see like how many beds are available, how many patients are in today, and how many patients are out. So they'll have the calculations in this feature only. So yeah. Then patient registration functionality allows the staff to schedule in appointments and record patient information. So uh, patient registration functionality is also there, wherein you record a patient information. So once it is there, then next time it will come, the patient will come. Once you do the registration, next time it will come, you don't have to do the registration again, you'll use the same information. That's why you're using MongoDB, right? So those informations are being there, and there is no size in MongoDB. Basically you don't define the size of a record or anything, so you can customize the size. And if you put the another thing also, the next detail, that okay, this person comes into this visit and this is what he has been, um, the status of his health right now. So you can update it based on, there is no size, so you can update the new records also in that, for that particular record. You can add more information for that particular record. So yeah. Then we have information management portal, so which holds the medical data of every patient. That was I was telling it. Physician can access the data, which increase efficiency efficiency significantly in case where different doctors are working on the same case. So for example, I like the doctor A has been treated this patient and given so many things that this is the medicine has been prescribed for 5 days. Okay, for following disease. Let's say he has some disease, some chronic lifestyle disease probably. So probably maybe let's say I'm not taking much big disease as of now. So maybe some chronic lifestyle diseases, because that takes a longer duration of treatment. Okay, so chronic lifestyle diseases, let's say we take some thyroid and anything. So what happens is for 5 days or maybe 20 days the person has been diagnosed with some of the medicines, and then next after 20 days, and then person will put the medicines and everything, what is their condition, what is their weight and everything, details are there. Like after 20 days after medicine, what improvement will be there, maybe A doctor has seen it. Now next time it will come, A doctor is not available, we'll be having a B doctor now. So B doctor will refer that information which is being given by A doctor and then prescribe the medicines, or maybe some medicines need not to take it further, or B medicine will give new medicines. And because in these chronic lifestyle diseases you really need to change the medicines. You don't have to continue take some of the medicines, you have to take it something and then break it, and then that's how it will work. So B doctor will they'll use the previous informations and give the new medicine, and which has to be continued now, which has to stop now, and what are the improvements from before 20 days before A doctor's medicines, and now what are the improvements are there. Based on that, B doctor prescribe the medicines. So this information portal is very important in many of the diseases. Okay, so when there are so that in this way, how it happens, like you have to take that your hard copies every time, right? And if somebody forget it, like let's say you don't have it, right, for the previous prescription, let's say you are going it for 4 or 5 months, after 4 or 5 months, and then you have something before 4 or 5 months and then it's been recovered or something, so doctor will have that information. Okay, if you are allergic to someone, that they'll see it and they'll based on that. And if you have some disease also prior, and then after 4 or 5 months you have some other disease, so I think that information really help them out to prescribe the medicine which is not affecting your previous disease, or we should not be allergic to anything. So I think that will really help them in prescribing the medicines. And we also develop an inventory management system that help administrate and keep track of the medical supplies and support automatically. Like that is also very necessary, because we need, if that is software thing, it will be like a lot of manual efforts has been reduced, so that we can see automatically reordering of supplies after a specific period. So we automate it. Okay, after, like for example, some things are using like cotton or napkins being used every time, and there are a lot of equipments also, medicines also. Okay, so based on like some medicines can be used like very frequently, so they'll do reorder of the medicine, they'll set it like based on this time, we can reorder it, so we can set the inventory, keep the inventory in track. I think this really helped them. So these are features are associated in their applications. Okay, so this also you should know that what all there in your application actually, and the software which you're working on. Based on that, you can derive your test cases also. So if you know the functionality, you can think broadly, right, what all should be there. Now we have billing management system. This features automatically calculates total charges that include consultation fees, lab test, and admissions, etc. Laboratory management facilitates staff to directly send patient testing requests to the lab and receive the lab reports. Are also like very automation, like it's through, like you can get it on phone. So based on that, you can do that laboratory management system. Then payroll system, which helps hospital administration to manage and automate payrolls. Okay, like payroll system is for the like the, if you have contract basis employees, so based on that you can do that also. I think these are the features which is being covered. What did we do for the project? Discovery phase, there will be a POC phase, risk-free trials. These are things that has been developed, like how the stage has been come, and your testing phase also is associated with that. Discovery phase, POC phase, risk-free trial phase, MVP development phase, full-fledged software development for web and desktop, testing and support and maintenance. And I think this is the complete project. It's not for one person, it's not targeting to testing. So I'm telling you that what are the perspect, but it's totally a project information to you guys, like what all components are there into the project, and what all what we say, what is the life cycle of the project that is being defined here. Okay, thank you so much, guys. I think this project really, it's a good project to make you understand and what all components. So if you're working on this project, I think if you have any other questions, please feel free to ask in the comment section. I'll be happy to reply, and I'm replying most of the questions until it is not targeting me. So yeah, don't forget to subscribe my channel. And for this new year, I'll just give you the all the best. And the one advice I can give you to guys in this new year, I'm gonna learn that I'll always choose wisely that whom I associate with, because I think your company matters a lot. So if you're living with a good person and if you're hanging around with a good people, the good qualities will also come in. But if you're hanging around with some people who are not concentrate or not focused towards their life, you also have some or other habits. So I think if you are hanging around with a positive person, you will be having positivity in your life. If you're hanging around some depressed person, you will be having a lot of uh, depression in your life. So choose wisely whom you are associate with. So this year, try to find some positive friend around you, and so that you can learn and grow together. So that's all from my end. Thank you, guys. Stay tuned for my next video.